Hi, my name is Ashley Lowry. I'm an Indiana State University nursing student, and the title of my presentation is The Importance of Vitamin K Injections in Newborns. The first thing we'll cover is who is at risk. The population at risk consists of newborns throughout all communities. Here are the following learning objectives for this presentation. So here's a little pretest to check your knowledge on the subject. If you don't know any answers, don't fret. I'm going to cover everything, and there will be a post-test given at the end of the presentation, and the answers will be provided. Here are some important facts about vitamin K. Vitamin K is made in the gut, and it is required for the coagulation, or in other words, the clotting of blood. Newborns need this essential nutrient to help their bodies with blood clot formation. According to the CDC, newborns who do not get a vitamin K injection within 6 hours of birth are 81% more likely to develop internal bleeding. Vitamin K injections play a crucial role in having a healthy infant. The main reason for vitamin K injection is to prevent internal bleeding in the infant. So here's a little bit of history for you. In 1937, research found that clotting times in newborns were between 30 and 60% of adult levels, and by day 2, the clotting times dropped to between 15 and 30%. Clotting times gradually began to rise from days 2 through 10, but this research led to the continuing belief that the deficiency in newborns needed to be corrected. So in 1939, 2 years later, vitamin K1 and K2 were isolated for use. Further research was done, and it was found that low clotting levels could be elevated by the administration of oral vitamin K. So vitamin K was then synthesized, and there were many trials that were commenced to find the most effective amount and route to be used in infants. And in 1961, the American Academy of Pediatrics has recommended supplementing low levels of vitamin K in newborns with one single injection that is administered within the first 6 hours of life. So one reason that vitamin K administration is important in newborns is because vitamin K does not cross the placental barrier. This means that while the baby is still in utero or inside the mother's womb, it does not get any of this nutrient. Despite any maternal dietary changes, it does not cross the placental barrier, and the baby just doesn't get any vitamin K that it needs. Breast milk contains only a small amount of vitamin K, and it's not enough to aid in the prevention of internal bleeding or to help with blood clotting. Your vitamin K deficiencies are more likely to occur in breastfed infants, actually. This is because infant formula is actually supplemented with vitamin K. Therefore, formula-fed infants have a lower chance of being deficient in vitamin K than breastfed infants. In the US, there are no licensed oral forms of vitamin K. There are preservative-free options for injections if the parents or caregivers or healthcare providers are worried about preservatives in injections. In other countries, however, there are licensed oral forms, but failures have been reported with these forms. No failures have been reported for the intramuscular injection of vitamin K. In 2013, the Children's Hospital at Vanderbilt in Nashville, Tennessee, saw 7 cases that were directly related to infants not receiving their vitamin K shots. These cases expanded over an 8-month period, and the infants ranged from 7 weeks of age to 20 weeks of age. Out of the 7 cases, 5 of the infants had gastrointestinal or brain bleeding, which can lead to permanent damage or even death of the infant. Physicians noticed in recent years that parents began refusing the vitamin K injection along with other childhood vaccinations. However, one must remember that the vitamin K injection is not a vaccination. It is an intervention for preventing internal bleeding. Here's a little review for why vitamin K shots are necessary and recommended. So remember, all babies are born with very low levels of vitamin K because it doesn't cross the placenta well. Newborns who do not get a vitamin K shot are 81 times more likely to develop severe bleeding than those who do get the shot. So since 1961, the American Academy of Pediatrics has recommended supplementing low levels of vitamin K in newborns with a single shot of vitamin K that's given at birth. Can you wait a few weeks to see if your baby needs a vitamin K shot? No, waiting may be too late. The vitamin K shot is recommended within the first 6 hours of life. What can happen if your newborn doesn't receive the shot? Babies can bleed into their intestines or into their brains, and the parents can't see it and they don't know that something is wrong. This can delay medical care and lead to serious and life-threatening consequences. And remember, breast milk alone is not enough to supplement the vitamin K needs of the infant. So overall, what are the risks of the shot? The risks are the same that are part of getting mostly any other shot. You can have pain, slight bruising or swelling where the shot is administered, but no other risks have been proven by scientific studies for vitamin K injections. So now it's time for our post-test. Let's see how you did. Number 1, what is vitamin K and how is it administered? Vitamin K is a vitamin that is required for our blood to clot. It's administered by an injection or shot, and it helps prevent internal bleeding. Number 2, do all newborns need a vitamin K shot? Yes, all newborns have low levels of vitamin K. Number 3, how soon after birth is vitamin K given? Vitamin K injection is given within the first 6 hours of life. Number 4, can you wait a few weeks to see if your newborn needs a vitamin K shot? No, waiting may be too late because bleeding may go unnoticed. Number 5, does breast milk contain vitamin K? Yes, breast milk does contain vitamin K, but in very small amounts, and it's not enough to help with clotting. Number 6, who is most likely to be deficient in vitamin K? A newborn that is breastfed, because remember, newborns that are formula fed, the formula is supplemented with vitamin K. This is why a newborn that is breastfed is most likely to be deficient in vitamin K, and the other 2 answers aren't even an option. Number 7, what can happen if your newborn doesn't receive the shot? Remember that newborns can have gastrointestinal or brain bleeding that can be life-threatening and that can go unnoticed. Number 8, are oral forms of vitamin K licensed for use in the United States? No, they are not licensed for use in the United States. They are licensed for use in other countries. Number 9, in what city were there 7 cases reported that were directly related to infants not receiving their vitamin K injections? Nashville, Tennessee. Number 10, who should you speak to if you have questions or concerns about vitamin K? You should always speak with a licensed healthcare provider.